Alrighty, so today I did Health Informatics in the Battle Against Drug Addiction by Brianna Smith, which is me. Okay. Okay. So what are some mental health consequences of drug use and drug addiction? According to SAMHSA.gov, some mental health consequences of drug use and drug addiction are as follows. Anxiety, paranoia, mood disorders, such as bipolar disorder, can occur, and lastly, increased risk of depression. Okay, so next we are going to describe the game theory model, economics, and how it relates to drug use in the epidemic, or how it relates to the drug use epidemic. So according to Universidadeuropea.com, the game theory model can be defined as the framework that analyzes the interactions made between the individual and the decisions that they make. Essentially, the outcome depends on the actions of the decision maker. So now we're going to refer to an article called The Modeling of the Prescription Opioid Epidemic by Nicholas Batista, which relates the game theory model to the drug use epidemic in many ways. So these are some of the ways that this article relates to it. Okay, if we do not control the amount of opioids that are prescribed, the problem of addiction will still exist. Individuals will first become addicted to legal prescriptions, then they will make the decision to start taking illicit drugs. Next, doctors will have a choice whether or not to prescribe opioids which in turn could potentially cause an individual to become addicted to illicit drugs. Next, what is the opioid risk stratification tool? The opioid risk stratification tool can be defined as a short questionnaire that is used to assess how likely the patient is to have an addictive tendency to opioids. And that is according to Webster 2005, which is one of my sources. Okay. Next, how can ML algorithms be used to predict drug use disorder patterns? According to PLOS.org, ML algorithms can be used to predict drug use disorder patterns in many ways. It can detect characteristics in patterns of personality, in patients' personality, which can lead to drug addiction. It can detect early signs of addiction before it truly even starts. And lastly, it can predict if someone is struggling with addiction will relapse. Okay. How can you be a health advocate for people suffering with drug addiction as a healthcare related professional? So, according to psychologytoday.com, you can advocate for people suffering with drug addiction as a healthcare professional in many ways. First, you can detect early signs of addiction and call for earlier intervention. Next, you can provide support to the patient and the loved ones when possible. Next, you can use the patient's healthcare, using the healthcare using the patient's healthcare team, you can collaborate with one another in order for the patient to receive the best care possible. Next, you can educate the patient on the risks of the drug that they take. And lastly, you can encourage them to seek professional help. And okay, our next slide is what are some risk factors that can lead to drug addiction? According to AmericanAddictionCenters.org, risk factors include the individual's family history, the current mental health disorders, and the influence of those around them, the patient, such as family and friends, unfortunately. The individual's current living situation or environment, which could unfortunately not be the greatest. Next, you can also see if they've used drugs at a very young age, that can be a risk factor. And lastly, if they're a victim of abuse or violence. And this is my works cited. Thank you.